Welcome to Marina Plastic Surgery. My name is Tammy and I will be your nurse guiding you through your breast surgery here. Everything I'm about to review is also written down for you, so you don't have to worry about memorizing anything I'm about to go over. Both the night before and the morning of surgery, you will be showering. You can wash your face and your hair with whatever you choose, but from here down to your toes, you're going to be using a special over-the-counter soap called Cleanse. It'll come in a little green bottle, it's liquid pink, and it doesn't lather. So you squish it out, rub it in all the lovely little nooks and crannies. You leave it on for a couple of minutes and then rinse it off. Coming out of the shower each time, pat dry off. There's no moisturizers or deodorant. The morning of surgery, there's also no makeup, no moisturizers on. Any and all jewelry comes off. Come to the surgery center in something very loose and comfortable that either buttons down or zips up, loose baggy pants, easy slip-on shoes. Once you arrive to the surgery center, they'll have you changed. They'll put you into a gown and a lovely little pair of underwear. You'll be meeting with Dr. Perez that morning. He'll be marking you, going over the procedure one last time. The anesthesiologist will then come get you, bring you into the operating room, get that IV started, and boom, you're off to La La Land. The next thing you know, you'll wake up in recovery with this lovely haute couture bra on, which basically means cotton dressings and an ace wrap. And this lovely thing will stay on for the next 5 days after surgery. So your ride will come, take you home, feed you breakfast, give you an antibiotic, give you a painkiller, and then you'll fall asleep. Once you wake up from that nap, everything from that point on will be clear, and then you are homebound, not bedbound. I want you up, going to the kitchen, to the living room, to the dining room, but you're not cooking, cleaning, lifting, moving, or pushing anything heavy. We will see you the next day for a quick visit, maybe 10-15 minutes, and it's really the doctor and I just looking at your incisions, but we're keeping the lovely haute couture bra in place. We will then see you somewhere between 5 to 7 days after surgery to take all this down and put you into a proper bra. And you'll be in our bras for the next 2 to 3 weeks after surgery, and then I will allow you to get into a sports bra and then an underwire bra if needed, somewhere between 6 to 8 weeks out from surgery. You'll be sleeping on your back for the next month after surgery, and you'll be sleeping slightly elevated for the first 2 weeks. I will be sending you a link to a pillow that I like off of Amazon that will put you at about a 45-degree angle, because you will find the further back you go, the heavier your chest is going to feel, and the higher you go, you can't sleep that way. So it's trying to find that happy medium of not flat and not at 90. And you'll sleep on that wedge for the first 2 weeks, and then the last 2 weeks, you'll just sleep flat on your back with your normal pillows. I will let you start showering somewhere between 5 to 7 days after surgery, and everything can get wet. And then you'll pat dry off, you'll put some arnica cream on, which I'll go over in just a moment, surgical pads, and then your bra. And I will be giving you 2 bras. It will be wear one, wash one. Coming out of surgery, your breasts will feel hard. We know that the implants are soft and squishy, but within an hour of him placing them, swelling occurs around it and your breasts will feel very firm and ride high. And over the course of the next 6 to 8 weeks, as that swelling comes down and the skin begins to stretch, they'll drop and they'll fluff out. Medication-wise, we're going to give you 4 prescriptions. One will be for an antibiotic that you'll start after surgery. Pain medicine will be Percocet, Ativan for sleep because you're sleeping on your back and you're sleeping elevated, and then Zofran for nausea. Majority of our patients don't get sick in the post-op phase unless you do not eat enough before you take the antibiotic or the pain medication. Something that we also recommend is arnica. Now, arnica comes in 6 different forms. You'll just need to pick up the cream version. And once I take down the lovely haute couture bra, I'll show you how thick and where I want it. And you'll be applying the arnica for the next 7 to 10 days once the wrap is down twice a day. Range of motion after surgery is limited. I will allow you to grab a sweater off of a shelf, but you're not allowed to put a 10-pound box up there. You can keep your arm motions to here, and when I do allow you to shower, you will be able to shower. Initially, most patients feel like this, but by about a week after showering, you'll be able to, move your elbows and your shoulders. For some patients, require them to do some kind of arm stretches in order to help relax that pectoralis major muscle. But I will show you those in person so you know how to move and what feels comfortable and what doesn't. And
when you should stop.